As an executive sous chef, Kevin Martin is on his feet 12 to 14 hours a day, 5 to 7 days a week. And when he'd get home following his shift, his legs would be so swollen and sore that he would have to elevate his feet.
It just started to get more and more painful, and I was taking pain pills daily just to get through a shift.
If you're working at a job where you're on your feet a lot, by gravity you're putting a lot of stress on your legs, and those veins are being stressed.
Unwilling to take the pain any longer, Kevin went to see radiologist Dr. Greg Warren at the DMC's Huron Valley Sinai Hospital. After an ultrasound evaluation, Dr. Warren diagnosed Kevin with varicose veins.
Varicose vein is actually a complication of a disease called venous insufficiency. The blood flow in our veins is going back to our heart, so it's actually coming up our leg towards our heart. And with venous insufficiency, there's an incompetence of those valves, which allows the blood to go in the wrong direction, back down our legs, and results in what's called venous hypertension.
Years ago, patients with varicose veins had to undergo a procedure where a cut was made down to the vein, and the vein was stripped out of the leg. These days, Dr. Warren performs a minimally invasive procedure called laser venous ablation that only takes about an hour. The laser heats the lining within the vein, causing it to collapse, shrink, and disappear.
Right now we're getting access into the greater saphenous vein under ultrasound guidance. So this is the laser probe. It's on the tip of a catheter here that we pass through a sheath, which is basically a bridge from the outside of the patient's body to the inside. And it's from this tip that we actually deliver the energy into the vein to cause the process for the vein to shut down. The laser, right now, it is causing a reaction inside the vein to result in the vein clotting off. There's damage to the inner lining of the vein itself. There's also a reaction of the heat energy with the red blood cell itself. So the end result is that the vein will contract and clot off, and it will terminate the flow within the vein. Okay, right now we're removing the laser and the sheath. And that is it. So all we have right now is just the small puncture site that we started with. Doesn't require stitches. All we do is we hold some pressure here to control any bleeding that may occur, which is usually very minimal.
Dr. Warren puts some bandages on the leg and sends the patient home that same day. The patient must wear compression stockings 24 hours a day for a week following the procedure and limit their activity for a couple of weeks.
I had the surgery on a Thursday. I was back to work on a Tuesday. I took shorter shifts for about a week, but I didn't notice that I was in any more pain after that. So my recovery was a lot easier than even dealing with the pain beforehand. My legs look a lot better. The swelling is pretty much gone. Even at work after 14 hours, my legs look the same as they did when I came to work. I'm happy I had the surgery, very happy. It's improved my life tremendously.
To learn more about laser venous ablation or to schedule an appointment with Dr. Greg Warren, log on to dmc.org or call 888-DMC-2500. I'm Emery King.